Hey everybody, Dr. Shook here. Today I'm back with another video on a connection between Candida albicans, a yeast that's found in everyone's gut, and rheumatoid arthritis, and in particular how that can drive inflammation and bone erosion or bone loss. And this is really important because if you're dealing with rheumatoid arthritis and you're having pain and inflammation, and even with treatment you're not improving, then there's something that's being missed. And this is one of those things that commonly flies under the radar. So I'm going to give you some ideas on how you can determine if you have it, what you might want to consider doing. But let's talk about first about Candida albicans. So this yeast is found in everyone's gut. When you have periods of time when you're stressed, or if you've taken an antibiotic, a lot of people have experienced it this way. They take an antibiotic and then it kills a lot of their gut bacteria, and then the yeast grows in, and then they develop these fungal infections, these yeast infections. And this is because this yeast is very opportunistic, and it will grow in if you've wiped out your microbiome for any reason, and it will, it's opportunistic. It's kind of like a weed. So it creates a lot of problems, but it can also lead to, brain fog. It can create gas and bloating. Oftentimes people will have like coated tongues with it. So this is something that is a major problem, because what it will do is it will commonly overgrow in the intestinal tract. And when it does that, it will often cause intestinal hyperpermeability or leaky gut. Now, the problem becomes when the yeast dies and it goes through its life cycle, it releases something called beta-glycans. Now, beta-glycans are incredibly inflammatory to the immune system. So when the yeast is present in the gut, it usually creates an environment that breaks down the intestinal wall. That the lay term for it, you may have heard this term before, leaky gut. The scientific term is intestinal hyperpermeability. So you can look it up, intestinal permeability. It is a factual term. The point here, though, is that the yeast releases these beta-glycans. They can pass through into the bloodstream, through this permeable or inflamed gut wall, and they trigger an inflammatory pathway that directly drives joint inflammation and bone erosion, so bone loss. So when the bone starts to deteriorate and break down, this actually can encourage it. So what you need to consider here is, first of all, there can be some testing done, some blood testing. You can do stool testing. There are a few different ways to look at it. But if you have any of these symptoms, there's a good chance, or if you've had yeast infections, or if you have a history of yeast infections, you might be dealing with this. So oftentimes what I recommend are low-carb diets, using a probiotic like Saccharomyces boulardii. That's a great probiotic to use. You can reduce sugar intake, obviously, with low carb. Make sure you're getting plenty of sleep to help the immune system. And listen, if you're looking for an exact dietary protocol, check out the link in my bio for our RA Reset program and to learn more about working one-on-one with me.